Let me begin by thanking everyone. I know 3 times more about Malta now than I did when I came in this room this morning, and yet I don't know if I know all I need to know. And I'll give you some examples. I was quite struck in one of the groups I went to at least, by the discussion of myths. And I wasn't sure if sometimes we were perpetuating myths in our discussions. People will know what I'm talking about. But one of my biggest concerns is whether we are in agreement about what the demography in Malta will look like 20 years from now. I still heard people talking about the shrinking working age population. Well, as far as I know, the working age population is going to increase. But I think that was really shorthand for raising again the issue about the dependency ratio. Fewer workers and more older people. And I do think that we need to have a clearer conversation, as I tried to suggest this morning, about what the dependency ratio means, what its significance is for policy and practice. It's so easy, as the World Bank did in the 1960s, to talk about the impending disaster of old age, the tsunami of pensioners as the baby boomers reach old age. The reality is, and we heard it many times this morning, that this is a group in the population who are making so many diverse contributions in our societies that we are not taking account of, not only in paid employment. Secondly, and related to that, it's obvious that not only do we have growing life expectancy and changing family structures, but the people that we are talking about, the older people, those of us aged 55 and over, are not only a lot of people, but a massive diversity of people. Aging 55, 65, 75, 85 and older. Very different family, income situations, very different experiences, very different preferences. And our strategies need to take account of this big difference between different groups in the older age population. And I was thinking back to the question earlier on about healthy life expectancy and fairness, and life expectancy and fairness. And of course, one of the obvious points is that the healthy life expectancy, the life expectancy of different social groups in our population is very different. We usually give examples from the UK. In the town where I come from, the average life expectancy of somebody who worked in the shipyards as a manual worker is some 14 years less than the life expectancy of professionals, lawyers and doctors. So our discussion needs to take real serious commitment and recognition of these differences in the population. I learnt also today that, yes, there has been pension reform in Malta, but the pension age, as I understand it, has been 61 and is now going up to 65. So it's not very surprising that the figures on employment rates in the 55 to 64-year-old age group were disappointing. It doesn't really help me understand why the participation rates among people aged 65 and over are so low. I had many comments from people during the coffee break about pension inadequacy in Malta, about how hard it was to live on very little money. It's surprising then that only, so to speak, officially, 4% of people over the age of 65 are in paid employment. But of course, all this discussion about pension reform and working beyond pension age is contingent not only on people's interest in doing so, but in having jobs available. And I do not know whether these jobs are available. Certainly, I should have emphasized this morning that although the story of older workers in Europe during the financial crisis has been quite good in terms of retention of employment and employment rates, when people over the age of 50, 55 become unemployed or lose their jobs, the reality is that the prospects of them returning to employment are very low indeed. So that's another side of the story. Much of the discussion has been around raising awareness. And I wasn't entirely clear sometimes whose awareness we were trying to raise, particularly whether it was raising the awareness of the general population or the young population. I heard many discussions about mentality of younger and older people. I don't know whether the ageing story is really on the agenda of many of these younger or older people. What I do know is that we need to bring it on the agenda in a more positive way than it probably is currently reflected today. Specifically, awareness of ageing for employers and for employees. Changing the attitudes of employers has been on the agenda in many countries for a considerable time, and I think that there are signs of positive changes in attitudes of employers. But we were asked several times, why do they take any initiative to improve age management or opportunities for older workers? And all I can say is from the 400 case studies we have in the foundation, we always asked the employer, why did you do what you did? And the answer was always because it made sense to me to do it. It made business sense for me to do it. I'd invested in their skills, in their training, the costs of recruitment, the alternative having to pay to recruit and so forth. So the business case is there for employers. And those of you perhaps who know the UK know that there is an employers association on age with a very large number of employers, mainly bigger companies, but also smaller companies, trying to spread the message that investing in the ageing workforce is worthwhile. And it's certainly a point that was made in one of the presentations now about the need to continue to invest in a lifelong learning perspective, because frankly, it's not a reality at the moment. So too for employees. Concerns not only about their competence and skills, but about their confidence, their self-esteem, their feeling that they've got something to offer, especially when they're over the age of 60. All I can say again is that we have many examples from companies, including those employing people over the age of 65, who realized that if they turned around and spoke to the employee and said, please stay on, we value you, your work is important to us, that the employee said, wow, I didn't really appreciate that and I didn't feel I was valued, and very often they do want to stay on. And I was delighted to hear so many references in the feedback about the new roles that these older employees might take, particularly those aged 65 and over, as mentors and coaches. I was also very pleased to hear or to see reflected the high level of awareness amongst you about the issues on working and caring, particularly for older women workers, but in general, I think there was a most impressive discussion about working and caring for grandchildren, working and caring for dependent spouses, and so on. The issue, though, is, of course, to translate this increasing awareness into some sort of action. And I know recently the employers and employees, the employers and trade unions at European level have developed a new agreement on reconciliation of working and non-working life. And the issue of work and care for dependent older persons was on the agenda, but it was not incorporated into the agreement, which again was primarily about workers with care responsibilities for young children in good health. And I think the same missed opportunity was reflected here in the conversation about Malta. Having said all that, my concluding note from this very engaging discussion has been it's terribly important to acknowledge the importance and the economic value of all the things that older people do in care and in volunteering, as well as the economic value of them in paid work. Thank you very much.